Hello, everyone, and welcome to the TMA Ask the Expert podcast series. Today's session is entitled The Role of Exercise and Rehabilitation in Non-Traumatic Spinal Cord Injury. My name is Roberta Peche, and I'm the Research and Project Manager at the Transverse Myelitis Association. We're a nonprofit focused on support, education, and research of rare neuroimmune diseases. You can learn more about us on our website at myelitis.org. Hosting today will be Chitra Krishnan, Executive Director of the TMA. Before I turn it over to Chitra, a few housekeeping pieces. This podcast is being recorded and will be made available on the TMA website at myelitis.org. During the call, if you have any additional questions, please send them to us via our Facebook page at facebook.com/myelitis.
Great. Thank you, Rebecca. I'm honored to introduce our guest today. We are right now joined by Dr. Daniel Becker. He is the director of the International Neurorehabilitation Institute in Maryland. He is also an assistant professor of neurology at Johns Hopkins School of Medicine in Baltimore, Maryland. Dr. Cassie Zakowski will be joining us shortly. She is an associate professor of physical medicine and rehabilitation and neurology at the Kennedy Krieger Institute and Johns Hopkins University School of Medicine. Thank you, Dr. Becker, for joining us, and a big thank you to all our listeners for joining us and sending us your questions in advance. I will do my best to get through as many as we can today. To start us off, Dr. Becker, can you give us an overview of the importance of exercise and rehabilitation after a demyelinating event or a non-traumatic spinal cord injury?
I would be happy to. Well, Chitra, thank you very much for inviting me to be on this panel. I'm always very excited to speak to this group of patients, and many of them will probably know me from the past in some way. So, and people who know me know that I really preach on the importance of exercise and rehabilitation after a demyelinating spinal cord injury, because it is extremely important. When I went to medical school, and that's a while ago now, I was taught that the nervous system has virtually no potential of recovery or of repair. We were always taught that when we were born with a set of neurons and brain tissue that we age with that, and there's no way of repairing that. Over the last 10 plus years or so, we have learned that this is actually not true. The concept now actually has shifted to the possibility of repairing the nervous system after a spinal cord injury, even if it's years later. And it took us a long time to kind of figure out, what is the reason? Why does the nervous system repair, and where is the potential coming from? And what we have learned was that our nervous system actually has stem cells sitting into it. Most people always think they have to go out to other countries where there are stem cell transplantations being done, but I don't believe that this is true, because we actually have all the tools for repair in our brains and spinal cord. And to kind of depict that, in the laboratory, what we can do, we can take those stem cells out of the spinal cord and we can stick them into the culture dish in the lab, and those stem cells will grow any tissue that we want them to. If we take these cells and stick them back into the spinal cord, they don't. On the contrary, we can take these cells and stick them in parts of the brain where we know that they make nerve cells, and they do that. We take them, stick them back in the spinal cord, and they don't. So there's really nothing wrong with these cells. The cells can do it all. There's just something wrong with the environment we're placing them in. And so what we have learned over the past 10 years is that what these cells need in order to do their job, in order actually to live up to their full potential, is that the connections that they're supposed to repair have to be active. If these connections are not active, they can't see them. And how do we activate the nervous system? This is where exercise comes in and rehabilitation. And not just like you do it once or twice a week. This is something where you actually could do this over long periods of time, since this process is very slow.
Great. So then, is there a time frame when you should start an exercise program, and how long should one continue? Like, for example, we've had lots of questions from our members who said, what if you don't see an improvement? Are you still improving? Like, can you continue to strengthen a weak leg, say, 10 years out after the original injury?
Yeah, I think this is possible. people used to teach, or physicians used to teach their patients that if what you haven't recovered within like 6 or 12 months, or sometimes people give like a 2-year timeline, then this is the final. And that is not true. The repair process in the spinal cord continues lifelong. It might be slower in elderly people than in kids, but overall it always continues. If you are following an active rehabilitation program, so even if you're out 10 years or 15 years after your injury, the potential is still there of repair. So you should never give up. Most people stop recovering when they're giving up rehabilitation, and then they sort of freeze their recovery in time. But if you sort of pick up a new program and kind of follow it more aggressively, then you can actually make an impact. And I think we're probably going to talk about this a bit later. One of the modalities that we like to add to the traditional exercise program, which we have recently learned may not be enough, is the modality of functional electrical stimulation, or FES, that can help sort of amplify the repair response in the spinal cord.
Would you want to, spend a few minutes talking about FES at this point?
I can. So FES stands for functional electrical stimulation. So what this is, it comes in all kinds of shapes and sizes. We use in general in the lab, in the clinic, electrodes that you can stick onto the muscles on the outside. So you stick, for example, if your quadriceps, it's kind of the muscle that straightens out your knee, is weak, then we put electrodes right over the quadriceps, and then we can stimulate them with some electricity, which makes that muscle contract. And how this happens is we're stimulating not the muscle, we're actually stimulating the nerve that connects this muscle. So when we stimulate that nerve sends a signal into the spinal cord. In that spinal cord, it gets switched over in this little microcomputer that we have in the central part of the cord, and that computer sends a signal out back to the muscle and says contract. And so we can do this pretty much with any muscle in the body. So we can do it with your leg muscles, you can do it with your hand muscles, kind of to make a fist. You can do it with your biceps. You can bend your arm. You can even do it on your trunk, which kind of helps you sit upright. And that's sort of where it becomes really important to kind of find the right rehabilitation specialist for you, because they can decide, which activities to do, where electrical stimulation to apply to, how often, what are the stimulation parameters, and how can you connect it with a function. This is where the functional part comes in electrical stimulation. Because just by stimulating the muscles, it may not be enough, but if you connect the electrical stimulation with a functional task, for example, with walking, or with grasp, or with standing, then it becomes much more effective than if you were just to sort of turn it on and then forget about it.
So do we almost always will see functional improvement while using an FES? And is there a time frame, for example? Like, you do it initially, you see muscle bulk, and then, and then you start seeing functional recovery? How do you measure it?
So the recovery from that is still quite slow. So if you start using a functional electrical stimulation program to a muscle, then at first what's going to happen is you're going to strengthen that muscle. And that's pretty quick. That kind of happens within 6 to 8 weeks. But for the true kind of repair happening in the spinal cord, where you sort of make new connections or repair old connections, that process probably takes at least 3 to 6 months. So that's why all our clinical trials in that field are all laid out at the 3 to 6 months range to kind of see the changes. And what we measure generally in the clinical trial settings are strength. We measure sensation as of light touch or sharp sensation. Then sometimes we can measure your vibration sensation, and we can give those things scores. And then we can sort of follow this along with the recovery. And most people experience kind of the fastest recovery within the first 6 to 12 months, and then recovery sort of becomes steady, and probably not on a pace that it was at the beginning, but it will always continue. So I saw some of the questions that were kind of concerned about, what happens if you plateau, if you're not making any progress. And that sometimes can be quite frustrating for the person, because you live in your body day after day after day, and you see tiny or no improvements over time. Whereas I, as a physician, have always the advantage, I see you every 3 to 6 months, and I can actually point out, where are your improvements? And they may be small, but they continue. And as I follow people, over the past 7 to 10 years, you can see annual improvements over time in virtually everybody. So that's why, you have to be closely following with your doctors to kind of help you monitor these things. You want to do this together with a partner. This could be your spouse. This could be another family member. It could be a friend. Because especially in those hard times when things are slow and you don't see the progression, then to kind of stay motivated and do these things together, it's generally very helpful.
That's fantastic advice. Thank you. Changing gears a bit, we've received a lot of questions about, symptoms like pain, fatigue, that get worse during exercise. Most people say, why does it happen? Should I still push through? Should I stop? Is there such a thing as too much exercise? And, some people describe symptoms like vision is blurring, darkening, numbness in feet and leg intensifies, body gets overheated. Is this normal? I mean, can this cause a relapse or a recurrence? Does it mean it's a new episode? How do you handle that in the context of exercise?
Wow, you just packed 20 questions in one. So to kind of take a couple out, can there be too much exercise?
Okay.
Conceptually, one would think that this is true. So on paper, we always thought there must be one level of exercise. Once you go one threshold, once you go beyond that, then it might be hurtful. And so we have never been able to achieve that in a person. And we have tried in a laboratory setting quite intensive regimens. Then we thought, well, if we can't achieve that in a person, how about we try to achieve it in an animal in the clinical trial setting? And we were unable to do that. So then we thought, well, maybe if we can't do it in a living creature, maybe we can do it in cells, in the culture dish. And so even there, we were unable to do that. So I still think there's probably a theoretical level of too much exercise, but practically cannot be achieved. So on the kind of as a caveat to that is people with demyelinating disorders are commonly limited by fatigue. Fatigue can be a big issue, especially if you haven't done much of an exercise program. Then starting one can be quite difficult because if you work out pretty vigorously, for example, if after this phone call you hang up and say, Dr. Becker said I should exercise, and then you go out and really overdo it, then you will probably be suffering for the next 2 or 3 days from this. So when we start these programs, you always want to start slow. And then as your body sort of gets used to this kind of level of exercise, then you can slowly start escalating your exercise program. And that's sort of what I like when we start with physical therapy. We usually start slow, and then as the patient gets better and can tolerate it, then we bring this out. I think the other question was, can pain get worse? Yes, it can. And some people sort of stop exercising because pain getting worse. Number one, you always have to figure out, what kind of pain is it? Is there a reason? Could you be having a joint problem? Could it be a knee problem, for example, or a hip problem that sort of makes pain worse? And if that's true, you want to see your orthopedic doctor. But let's say all the mechanical problems have been rolled out, and it's probably more like a nerve pain problem that we see commonly in demyelinating spinal cord injuries. Then, you want to work closely with your physician to make sure you're sort of on the optimal pain regimen. Overall, the more inactive you are, generally the more pain you're going to have. So most people realize that once you get in a more active exercise program, the levels of pain will long term come down. So I think that's why if you start slow, and work your way up, you will actually notice that your pain levels will improve. People commonly go into that dangerous spiral of having more pain, and because of more pain, you do less exercise, and then you have less exercise, you get more pain, and so on. And so people then end up in this trap that's really hard to get out. Did we answer most of those questions, or are there more?
You certainly did. No, that's perfect. We actually did receive a question related to this on our Facebook page. This comes from the UK, from the chair of the UK TM Society. She asks, can intensive neurophysiotherapy during the acute stages of transverse myelitis, when a person is paralyzed, make a big difference in the recovery process than having just some or no neurophysiotherapy?
So,
and this is echoed by somebody else too. They asked, what if I'm in a wheelchair and I can't exercise? What, is it going to make a difference?
So how to exercise in a wheelchair? Is that the second question?
Yeah, so it is, exercising in the wheelchair, and then in the acute stages when a person is still paralyzed, do you start physio then? Is it going to make a big difference in the recovery, or should, have some physiotherapy or none at all?
So here at our center, we start as early as possible. I used to run the spinal cord injury inpatient service, and up until last year, and we started intensive exercise programs pretty much from the get-go. As soon as the people are cleared from the primary neurology team or the primary neurosurgery team, then we started pursuing a more aggressive program. Because everybody with an acute injury will inevitably fall into this very catabolic state, meaning during the first couple weeks and months after the injury, there's muscle that sort of starts degenerating, bone loss will occur, and sort of things in the area of paralysis will rapidly decline. And there's no medication that can offset that. But we believe that exercise can at least slow down this process. So that's why we start as early as possible. Are there clinical trials in that? I'm not aware of any clinical trials data, but this is our experience over the past 10 years, that starting the earlier the better. The question, what you can do when in a wheelchair, and many people ask that question. They say, well, I'm in a wheelchair, how should I exercise? There's no reason that you can't exercise because you're in a wheelchair. You just have to sort of modify your exercise that's out there. There's virtually no sport out there that has not been adapted in any way. You can do any kind of weightlifting. You can do standing with the right devices. You can do walking with the right devices. But for that, you need a skilled physical therapy or physio team. When we talked about earlier about the use of functional electrical stimulation, there is a bicycle out there. It's called a functional electrical stimulation bike, or FES bike, which can actually enable people who are in a wheelchair and cannot move their legs or even their arms to cycle on the bicycle and sort of get the full exercise, the full benefit of exercise on this type of device. How this works is the people will roll out of their wheelchairs to that bike, and then we connect electrodes to their legs and to the kind of the quadriceps muscles, to the hamstrings, and to their glutes. And then the computer of that electrical stimulation bicycle will sequentially activate the right muscle, that you can actually pedal that bike on your own muscle power, even if you don't have voluntary control over it. That's probably one of the most effective ways for us currently to provide an intense level of exercise to people who otherwise could not do those things.
All right.
Does that help?
I'm sure that's very, very encouraging to so many people who are listening at the moment and who will download this podcast as well. Going back to sort of these symptoms that get worse, people fear about a relapse or a recurrence or a new episode. Can exercise trigger that?
I'm not aware that exercise has ever triggered a relapse. What can happen is, I see this more commonly in multiple sclerosis than in transverse myelitis or in NMO, where if you have a very intense exercise program and you sort of raise your body temperature because of, the more you work out, the higher your body temperature gets, people tend to get worse with higher body temperatures. So if you sort of overdo it, you may have sort of a transient or like a pseudo exacerbation just because of body heat. But I'm not aware of exercise actually triggering relapses. In fact, we've just published a paper that's coming out in the Journal of Spinal Medicine, where we show that people who are in these exercise programs seem to do better long term. These are patients with multiple sclerosis. So, implying that it can't really be triggering a relapse. So I think if it happens, it will probably be coincidental, but most likely not triggered by the exercise program.
That's great to know. And you brought up the point about overheating. Any advice about, people should they stay out of hot weather? Does change in temperature affect muscles? Is there any remedy? What should people be watching out for to prevent overheating?
Well, so not everybody with TM or with a non-traumatic spinal injury who gets hot will get worse, but the majority of people do. So if you know that you're a person who has that problem, then yes, you want to sort of avoid getting exposed to a lot of heat, which is not always very easy. So you want to, in the summertime, for example, you want to stay in a climatized space if possible. If you have to leave that sort of safe environment, there are several options of cooling devices that have been out. And if you go online, there's a whole host of companies that sort of offer different types of cooling devices like vests or little scarves that are cooling, or even whole cooling jackets. So that's something that I know in my patients seem to be quite helpful. And otherwise, you want to avoid your heavy exercise programs during that time frame when it's so hot outside. Sort of move it into a climatized space, and B, maybe into the times of the day when it's not so hot outside.
This is Kathy. Can I interject too, Dan?
Please.
So another thing to keep in mind, I find that many people will say, well, in the heat it gets hard, I often feel more symptoms, so I'm just going to avoid exercising in the summer. So I think that's something to really reconsider. There are ways to adapt it, like Dan was suggesting, but really just thinking through how can I maintain my activity level and maybe change up what I do for exercise based on the season, right? So doing things indoors like Dan was saying, but if you really want to be outside, drinking cold water, there's some ice packs that you can even wear just as a scarf around your neck that often will help. Being around areas where there are fans. So I guess my main message here is don't stop exercising. You just have to reconsider how to exercise and recognize that there's no gold standard for how best to do this. So whatever you're going to actually keep doing, that's the kind of exercise you want to use.
That's great. Thank you. Thank you, Dr. Zakowski, for joining us. And has Dr. Farrar been able to join us?
Yes, I'm here.
Oh, fantastic. Excellent. I'm glad we're all here. Thank you. So maybe I can pose this question to you, Dr. Farrar. This one came in, and the question, it's a long one. I'm going to read it out. It says, if an exercise is done incorrectly, not insufficiently, but incorrectly due to weakness of a muscle, will practice make perfect, or will this cause an incorrect habit? For example, in doing a single leg squat, the knee comes inward and crosses midline due to either tightness of the inner thigh or weakness of the abductors, or doing lunges with the back foot twisting outward at the base. do you think practice makes perfect? Should one continue, doing exercise? It seems it's being done incorrectly because of weakness.
Okay. I think that absolutely when you are considering any exercise, so this example here of a single leg squat, you have to consider kind of what the maybe even short-term but mostly long-term effects would be of doing something incorrectly biomechanically, if you will, at the joints, what that's going to have an effect on, how that could affect you longer term. So how that could create compensatory strategies or just alternative ways to doing something that you don't want to become a habit. So I think this patient was asking, yes, if it would cause an incorrect habit, and I absolutely do think that, yes, it could cause an incorrect habit. So the goal that we're after is then to try to set somebody up with whatever kind of external support or assistance, or maybe even modifying an exercise or a task so that they're able to do it as close to biomechanically correct as their body will allow, and then working from there to be able to strengthen or improve their walking or improve whatever the task is at hand.
Great, thank you. In Dr. Zakowski, in terms of effective exercise on neuropathy or banding or involuntary leg tightness, has there been any research or even anecdotal evidence sort of saying which exercises are best for banding, for weakness, for neuropathy?
Well, so those are three very different things, but I would say the evidence, there is some evidence to suggest that if you stretch the areas where you're feeling the tightness, that if any of the banding is even being contributed to by tightness, by muscle tightness, then stretching should make it feel better. For neuropathy, it's really driven by the nerve, the firing of the nerve, and so stretching may not make a difference, but it's worth trying. There are medications that can more directly affect neuropathy, but they have side effects. So the beauty of stretching is that it's a lot of effort on the person's part, but there's really very few side effects. The downside, of course, is that it has to be very specific to where that muscle is. So instead of just doing general strengthening, I think the message is it needs to be really specific to where you feel the tightness and try to understand what the underlying muscles do in that area, and that's where going to see a physical therapist would be really helpful. And as far as what is the right kind of exercise, I would follow the same guidelines that everyone else does. You just have to adapt them some. So the general guidance is you need some cardiovascular exercise, you need some resistance training, and so working within the system that you have is the important thing. So you can still do cardiovascular exercise, whether now it's on a stationary bike. It could even be an arm ergometer instead of a leg ergometer. So that's a type of hand. It's kind of a cycle for your arms, because cardiovascularly you just want to. I guess the practical way to think about it is you want to get out of breath. You want to be able to make your heart rate higher. And so it doesn't require you to use your legs, but that is really important for your general health. And then resistance training is just using weights that are specific to the muscles you want to train. And going to a physical therapist or someone that can show you specific exercises that will address the muscles that are the weakest for you would be the right way to start. You don't necessarily have to see that person every time you exercise, but that's the way to start it.
That's great advice. So, this also brings me to another question that we just got on our Facebook page. Physical therapists simply don't know what TM is, so they're unable to provide specific rehabilitation services like FES. So can I tell them I have an MS-like condition, and then will they know what to do?
Right, that's a really complicated question, right? It depends on the therapist you're seeing. There are articles that describe transverse myelitis as being similar, to a spinal cord injury, and also it's similar to multiple sclerosis. So any exercises that would be appropriate for those two populations, again, you would want to modify them, but that would be the direction I would tell your therapist to look. And I would say, even as a patient, it would be good if you could, if you would have the articles or know of where to direct them, because you want your therapist to be invested. And the way our medical system works is the more you as the patient are invested, probably the more likely you'll gain from the medical system. So being aware of new research that's coming out. So through the Transverse Myelitis Association, they're good at sharing new information about TM. So bring that information to your therapist so they don't feel quite so that they know there's some direction, but really you can address things based on spinal cord injury or multiple sclerosis.
That's great advice. Dr. Becker, Dr. Farrar, anything you'd like to add from the perspective of how to approach a physical therapist?
Yeah, I mean, it's a tough call because it is very difficult to find therapists that are really just specializing in like MS or MS-like conditions. So that's sort of what we have kind of encountered over and over. So what we are trying to help with in that field, we're trying to teach therapists outside, by using you as a resource, kind of spread the knowledge. But also what sometimes helps if the therapist is willing to travel to a center that has therapists that are familiar with MS, then you could teach your own therapist. We have done this from time to time, that people came from other countries and brought their own physical therapist with them, which then you could take home. On the other hand, what's more practical in the setting is, so people come to us, we send them home with a very detailed home program, which sort of encounters all their, the things that we anticipate that could be going wrong, and then they take it to their own therapist locally, and ask them sort of help them follow this program. But I think overall, it's still an uphill battle for most listeners to kind of find a therapist who specializes in that condition. Even if you broaden it and say, let's make it MS-like, it's tricky.
Yeah, I would agree. I would say definitely just empowering the patient is what I try to do most of the time. So exactly what Dr. Zakowski and Becker have both said already. But just I would tell the listeners to use the TMA website and to get maybe a factor info page at least to be able to share with the therapist that is unaware. But generally speaking, spinal cord injury related rehab and MS related rehab sort of married and modified would be a good place to start.
Great, thank you. And just maybe I can ask you this question, Dr. Farrar. What about alternative therapies? Things like acupuncture. I mean, are these things that you recommend, that people try for numbness, tingling, burning to help regain feeling?
Those are not necessarily any things that I personally have a lot of experience with. I've had patients that have come in that have tried those things in the past and have mixed results. So some people have said that they have had a great improvement in either sensation, sometimes even in temporary improvement in strength following an acupuncture treatment. However, the evidence for that obviously is limited, but there probably are a lot of alternative treatments that are out there and available. I would say just asking questions and doing as much research as you can before pursuing one of those things would be my recommendation.
Great, thank you. This is a specific question for you, Dr. Becker. Dr. Becker, your colleague, Dr. Levy, has discussed the use of stem cell therapy to remyelinate damaged nerves in the spine from NMO attacks. Once the FDA approves this procedure or treatment and after the person recovers, how much rehab will be needed?
Thank you very much. I love that question because that question sort of plays into something that we have been working on over the last couple of years. because with the anticipation of stem cells arriving in the future, we have to see, what can we do to help these cells to actually achieve their full repair potential. And so for that, we did a while ago, we did a clinical a trial in animals where we transplanted stem cells into an injured spinal cord, and then we took half of the animals and we trained them very aggressively with exercise and functional electrical stimulation, actually specifically functional electrical stimulation, and the other half of the animals we just did traditionally, we just let them recover. And it turned out that the animals that had the combination of stem cells plus exercise with electrical stimulation did a whole lot better than the other group. So I think overall what we've learned from that is that stem cells is not the only answer. Just putting in stem cells is not going to be. I don't think there's a magic bullet or that will sort of fix everything with one hit. So I think it's probably going to be a combination of exercise, electrical stimulation, stem cell therapy to kind of move forward. Also in part because the stem cells that Dr. Lee probably talked about may have an effect on the stem cells that you already have in your spinal cords that might be helped to do their job better. So overall, yes, stem cells, when they come in, you definitely will have to combine it with some sort of activity-based program.
Great, thank you. This is a question from Facebook, and maybe I can direct this to you, Dr. Zakowski. It says, I'm finding the tiredness is so overwhelming. It's hard to get motivated to exercise. What can I do to combat the tiredness?
Yeah, that's a really good question. I hear that a lot. It is, I guess, knowing ahead of time that it's going to need to be, when you start exercising, it's going to need to be very structured. So you might approach it more similar to when you have to get up and go to work, for example. So you might not want to get up that morning, and you might not really want to go to work, but it's your obligation. Another analogy might be when you take medications, there's a schedule to it, and you have to take the medication at the right time for it to be effective. So exercise is really similar in that if you don't do it regularly, then you lose all of the benefit that you gained. So one approach would be to try to mentally prepare yourself by saying, this is going to be my obligation of what I need to do. Another suggestion might be to set it up so that you're doing it with other people, so that you feel more of an obligation, and it might be more fun because you're with other people. Another idea might be, so either with friends from outside your home, or try to encourage your family in your home to participate with you. A third point would be you want to make sure that you allow yourself rest, so that maybe the benefit of exercising for you is that it allows you to have an extra rest during the day. So you'll say, today is my exercise day, but I'm going to allow myself a nap in the middle of the day to recover from that. And so then perhaps it might not seem as overwhelming for you to complete the rest of your day.
That's fantastic advice. Thank you. So the next set of questions are really about water therapy, and maybe I can direct them to you, Dr. Farrar. This specific question says, I have TM, my lesions in the conus area. I'm having good, albeit slow progress with water therapy and exercise. My leg muscles have responded in the warm water pool. Does anyone have experience with water exercise? I go 3 to 4 times a week.
Okay. So aquatic therapy or water therapy is definitely a great alternative setting or environment for people to exercise, do different sorts of activities in. There oftentimes, the specific question was with regards to a warm water pool. Sometimes warmer water will kind of lead into that fatigue problem for some people, but if that is not something that affects you, then the temperature of the water may not be something that you need to be as concerned about. depending on kind of what your goals are for water therapy or what types of activities or exercises you are doing in the water, I think that it can certainly be a great, like I said, alternative environment to doing activities. One question that I think I'm often asked by patients is walking in the water a good kind of alternative to practicing walking over ground? And there's not a lot of research out there on what that on the answer to that, but what is out there. And if you think about kind of what happens to your body when you're in water, it makes sense. So when you're in a body of water, your buoyancy and the resistance that you're working against, all of those things change dramatically compared to what your body is working against when you're walking over ground. So I would say, generally speaking, I would not use water therapy to work on walking specifically to try to have that transfer to walking over ground. I would try to find some alternatives to practicing walking if there was a challenge to doing that. But just generally for strengthening and exercise, to get some cardiovascular exercise, I think water therapy would be a great use.
Great, thank you. I mean, anything else you'd like to add, Dr. Zukowski, Dr. Becker?
No, I think that was a good, thorough answer.
Yeah, I mean, I think I really like supplementing land therapy with water therapy, because people who have limited movement of some of the muscles above ground can actually see how these things move underwater. So by eliminating gravity, it can make psychologically a huge impact on people. And then kind of in terms of trying to achieve their long-term goals for their rehab, I think it's a great supplement. And I don't know if I didn't look at all the questions. People who have read about me may have seen that I really like the water as a potential therapy option. Specifically, we did the trials on scuba diving, but we can probably talk about this at some other point.
I actually thought of something to add to you, if it's okay. I feel like what's come up over and over throughout this time is sort of recognizing that with exercise there's a psychological component that goes with it. So keeping in mind that the way a lot of people exercise with and without TM is kind of by finding things they enjoy. So keep in mind that it's very linked. So if you enjoy being in the water, then that is where you should. That's an area that you could really emphasize. But if you really hate being in the water and that's going to be like drudgery for you to get in, then that's what you should also tell your therapist, so that you're kind of being directed to something that you're going to enjoy, or at least try to carry over.
Absolutely. Dr. Becker, I mean, this would be a good opportunity to share about some of the scuba work that you've been doing.
So a couple years ago, one of the my transverse myelitis patients who has a foundation, it's called the Codianza First Step Foundation in Albuquerque, New Mexico, had approached me and my colleague Dr. Adam Kaplan because she had noticed that, and the person had transverse myelitis when she was 12. She had noticed that when she went scuba diving that the longer and deeper they were in the water, she noticed more sensations in regards to her bladder and some sensations in her lower extremities. But then she took patients with her diving, and they had many of them had reported improvements in sensation or strength. And so she asked us to take a look at this and see whether or not there's something real to it. So we designed a small clinical trial, which we conducted at the Cayman Islands at the time, and we looked at 20 people. We looked at 10 able-bodied people and 10 people with paralysis from either traumatic spinal cord injury or non-traumatic spinal cord injury. And we had measured very meticulously their response in terms of strength and sensation, and then a lot of psychological outcome measures. And to bore you with a lot of data, what we had shown is that after 1 week of diving, and the people were about 15 years out of their injuries, kind of the time frame when most people would have thought, well, there's no change be happening. And referring back to the earlier question you gave me, is it ever too late to start anything? And I said no. And that sort of proves that concept, because even after 15 years where most people were at, we saw these dramatic improvements in sensation and in strength, and in addition to the psychological outcome measures, just after 1 week of diving. And I think at the time we dove about 60 feet for about 30 to 45 minutes, a total of 10 dives over the course of a week. Unfortunately, the effects from diving, they only last for about 4 weeks, and then people return to their baseline. So it's not the cure for paralysis, but what it showed us was that there are actually connections that are still able to function if you just give them and put them into the right environment. So it's very exciting stuff, and I'll be happy to talk about it in more detail, but I don't want to take up all the time for this talk.
That's great. Perhaps we can write a blog post and share it on our website so people can learn a bit more about the study. That would be great. And there were a couple of questions. They were more specific, but they all had to do with sort of, setbacks. For example, if there was a fall, or you develop major flu-like symptoms, and you exercise one day and the next day you're in bed. Do you have any overall advice about how to approach, doing exercise at home between going to a physiotherapist, for example? Maybe Dr. Farrar, you could start.
Yes. So, I think this is definitely something that everybody will face at one point or the other, and needing to have a breakup in therapy visits or for one reason or another. So something to kind of always keep in mind is that what you were working on in physical therapy, yesterday or last week may not be applicable today or tomorrow if you did have a setback, if you did have a fall, if you did have flu-like symptoms or any kind of new onset of any symptoms. So something, I think, first and foremost to consider if it is one of those kind of things, if it's a fall or flu-like symptoms, like you said as an example, that would be something that you would want to reach out to your doctor about and ask and clarify and make sure that there isn't something new or different going on with your disease, or that there isn't something else that's making you sick. If you have had a fall, obviously, if something needs to be checked out, if you need to have, if you hit your head and you need to have a scan, or if you feel like you really injured something, having that checked out before you try to continue with an exercise program would be my recommendation. And following that, if it's something maybe less obtrusive or less involved, and it's something that you just feel like you kind of got a setback, then that might be a time where you may have been discharged from physical therapy, and that might be a time where you call your physical therapist back and say, can I come in to kind of maybe get a booster, get a jump start back on what I should be doing. But because spending a significant amount of time away from anyone who's sort of directing your exercise program, it may be beneficial to have someone kind of give you input to kind of get a restart or a jump start on a program. I know that was very broad, but I hope that kind of answers the question.
Can I comment too? This is Kathy. The sort of the opposite extreme is what I see often is that people will feel new symptoms, and then they'll say, well, I'm going to go see the doctor in about a month or two anyway, so I'll just wait. And then they stop exercising, and they just wait for their appointment to come. And remember that you work really hard to make gains in exercise. So just allowing it just allowing a few weeks to pass, even a week to pass without any exercise, you're really losing ground quite quickly. So it's really important for you to be upfront and call the doctor and say, I'm having these symptoms. Is this something where I should be limiting my activity? And if they say, well, we don't know, we need to see you, then see if you can make your appointment more quickly than waiting for a few months. Because it really is, it takes a lot of effort to make gains in exercise. And then I find people get very frustrated. So then they want it, then the motivation to exercise leaves because you feel like this happens again and again, that I get setbacks. And so the more proactive you can be to try to keep yourself on task, but still listening to your body and staying very safe with the kind of exercise you do is very important.
That's very good advice. I'm sure a lot of people are nodding like I was. We have about 5 minutes left. I'm really appreciative for all the time. I know all of you have patients that you were seeing, and you took the time off to have this conversation with us. So I'm very, very grateful on behalf of the TMA. Any closing comments from all of you, just for our listeners to sort of keep in mind? Dr. Becker, would you like to start?
Well, I think one of the most important things I always try to point out is that it is never too late to start exercising and to become more active in your rehabilitation. Number one. Number two is the recovery from this type of injury never stops. It just may need some tweaking in terms of the therapy goals and practices, but overall, do not give up. Take a partner, go out and do things, and you will know that by the more active you are, the better you're going to be getting. And we as the physicians and therapists are there to help you through this process.
Great. Thank you. Dr. Farrar?
Yes, absolutely. I would say just be sure to know that I would agree with what Dr. Becker said. It's never too late to start therapy or to start rehab, and it is a lifestyle change. Exercise and just kind of focusing on general wellness is important to everyone. So what I always tell my patients, nobody is exempt from exercise, and we just have to acknowledge that it needs to just be part of our everyday routine. I think maybe Dr. Sikowski mentioned earlier, like considering it just like getting ready for work in the morning, or just like another part of your day that you are committed to doing. So just know that kind of mindset is something that I see often that can be very helpful for my patients, is just acknowledging that just committing to it and knowing that it will take time to get into a routine, but being patient as you kind of get into a routine and then using that routine kind of lifelong and tweaking and progressing and changing as you have life circumstances that change or as you have progress.
Great, thank you. Dr. Sikowski?
Yeah, I was thinking as I was listening, those are all really important points, but to not lose sight of this idea that you can have fun with this. So if it's just drudgery, it's really hard to maintain. But if you can make it in your system so that it's a part of what you enjoy, maybe it's that you have to complete your exercise to get to the coffee that you really want that day. Or as I watch my children play on the playground, it's just really enlightening to see how happy they are when they're moving. And so that kind of mental outlook is really important because it is a lifestyle change. This isn't something that's going to go away in a few months. And the reality is that as we all age, moving gets a little harder. So the more we can work it into either our social system, so we have friends doing it, or we do it with music, or it's linked to some kind of goal like your coffee in the morning, something that you look forward to, that might help you maintain that level of activity that's so important and will make a difference in how well you move throughout your day.
That's fantastic. Thank you all so very much for giving us your time. We are so grateful, and this podcast will be recorded and made available on our website for others who weren't able to join live, perhaps because of the time difference, to be able to listen to it, download it, and gain the advantage of all the advice that you've shared. Thank you very much.
Thank you.
Thanks.
Thank you.
Bye-bye.